Welcome to our 5 on 5. We're joined by registered nurse Charity Barrueta, the stroke program coordinator for the Rogue Valley Medical Center Primary Stroke Center. Charity, long title, great to meet you. How are you?
Thank you very much. Good.
All right. So let's say it's Stroke Awareness Month. What do people need to know about strokes?
Strokes are, 80% of strokes are preventable. So with looking at your risk factors, and we can talk about that a little later, and reducing those, you can drastically reduce your risks of having a stroke as well as the successful outcome if you do happen to have a stroke. Another thing I'd really want people to know is the signs and symptoms of a stroke and what to do when those happen.
Feel free, go right into it. I mean, this is what we want people to know about.
Okay, great. So the signs and symptoms of a stroke, we use the FAST acronym. So F stands for face. So you look for facial droop for the F part. A is for arm. So arm numbness, arm weakness. You can ask somebody to hold their arms up. If one of them drifts down, that signals a weakness. The S stands for speech, so slurred speech is a big indicator, as well as trouble understanding what people are saying or trouble getting the words out. The T stands for time. It is crucial to call 911, get to the hospital immediately, get to a primary stroke center. Statistics have shown that patients treated at a primary stroke center have better outcomes long-term than those treated at non-primary stroke centers.
Okay, so a layman like myself, you know, I've heard the word stroke many times, and in some of the things you just talked about with FAST, you know, they make lots of sense. I've heard them before, I feel like. But what exactly is a stroke? What happens inside I assume it's the brain?
Yes. Another way of thinking of it is a brain attack. So there are two different kinds of stroke. The most common type is called an ischemic stroke, and that's when a clot is lodged in the brain and it prohibits blood flow to a certain portion of the brain. And without that blood flow, that vital glucose, that vital oxygen, the brain cells begin to die. The other type of a stroke, which is less common, about 12% of strokes, is a hemorrhagic stroke, which is a bleeding type stroke. And that's when the blood vessel bursts, or even an aneurysm bursts is another type. And so the blood flow is diverted through that burst instead of up through the normal pathway to, again, oxygenate and give glucose to the brain cells.
Fascinating. All right, well, we're halfway done. We're going to take a quick break.
Okay.
Much more with Charity in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with registered nurse Charity Barrueta. We're talking about strokes. Who is it most at risk for strokes and why?
There are certain risk factors that put somebody at greater risk for stroke. So somebody with high blood pressure, with high cholesterol, with uncontrolled diabetes, with obesity, people who don't exercise regularly, people with atrial fibrillation, which is an irregular heartbeat, people who smoke, puts you at greater risk. So any of those risk factors that are also the same risk factors as for cardiac disease that people are more familiar with, they put you at a higher risk for stroke as well.
Yeah, okay, and I understand if something happens, you know, God forbid something were to happen that you think you may be having a stroke, it's vital to immediately act, correct? Vital.
Your brain cannot live without oxygen and glucose for very long at all. In fact, 4 to 6 minutes. So it's vital to call 911, get them there, get the help, go to a primary stroke center to be treated, because the faster you can get help, the more treatment options are available to you and the greater your success outcome.
Yeah, absolutely. Okay, and now I understand you guys are doing something with OHSU, telestroke. Well, what in the world is that?
Yes.
Tell us.
Yes, so telestroke is a link with Oregon Health Science University, OHSU. We're using it for acute stroke. So when a patient comes into the emergency department, we can immediately link by way of a very fancy robot computer up to OHSU, and then the stroke neurologist who is specialized in stroke care can evaluate the patient by looking through this robot and can zoom in to do assessments, can look at the brain scans that we have done, the CAT scan, can talk with our ER physician, and then recommend the best treatment options available.
And you guys have been a primary stroke center for how long now?
Since 2003.
Since 2003,
so
okay.
Experience and time.
Are you guys getting, I mean, are the numbers going up? I mean, how Are people noticing strokes more, or how do you think that works?
We are seeing people come into the hospital sooner, which is excellent, and so we can give those life-saving treatments sooner. The numbers of stroke patients coming in is pretty stable. We see in the Valley about 300 in the Valley each year. And then we see, probably about 200, 250 of those.
Well, Charity, great to see you. Thanks so much for coming. I appreciate it.
Thank you.
All right, stay with us. We'll be right back.